What if I told you that the single most important factor in whether you feel energized or exhausted, sharp or foggy, alive or barely functioning comes down to one thing most doctors never even discuss with you? Blood flow, not cholesterol numbers, not blood pressure readings, not the metrics they test and medicate. The actual physical movement of blood through 60,000 miles of vessels, reaching every organ, every tissue, every cell in your body. When blood flows properly, everything works. Your brain thinks clearly, your muscles recover, your organs detoxify, your wounds heal, your heart functions without strain. When blood flow is compromised, everything deteriorates, silently, gradually, until one day you're exhausted for no reason, your hands and feet are always cold, your memory isn't what it used to be, and your doctor runs tests that come back normal because the tests aren't measuring what's actually wrong. Ancient healers understood blood flow was the foundation of health thousands of years before we had the technology to watch it happen under a microscope. They couldn't name capillary density or endothelial function, but they could observe that certain herbs made people warmer, faster to heal, sharper in thought, and more resistant to disease. And they built entire medical systems around those observations. Today I'm showing you 13 of those herbs that ancient physicians prescribed specifically for circulation, that modern science is now proving work through mechanisms so sophisticated they make some pharmaceutical approaches look primitive. Stick around because number 9 on this list was the most valuable circulatory medicine in the ancient world, literally traded for gold. And vascular researchers just discovered it repairs damaged blood vessel linings in ways no current medication replicates. And number 13 does something to nitric oxide production that cardiologists are calling a game changer. Subscribe right now. Let's get into it. Number 1. Ginger, the circulation igniter. Ginger, Gingiber officinale, has been prescribed for cold extremities, sluggish circulation, and blood stagnation across Chinese, Ayurvedic, and Arabic medicine for over 4,000 years. The ancient term for what ginger does was warming the channels. Modern science calls it peripheral vasodilation and platelet aggregation inhibition. Same observation, different vocabulary. Gingerols and shogaols increase blood flow to extremities by relaxing blood vessel walls, reduce blood viscosity by inhibiting platelet clumping, and stimulate circulation throughout the digestive tract, improving nutrient absorption. Clinical studies show ginger decreases platelet aggregation comparably to aspirin without the gastrointestinal bleeding risk. It reduces inflammatory markers that contribute to arterial stiffness and improves blood flow velocity in peripheral vessels. Traditional use was fresh ginger tea daily, especially during cold months. The warming sensation isn't just subjective comfort, it's measurable vasodilation happening in real time. Every ancient physician who prescribed ginger for cold hands was prescribing a clinically validated circulatory stimulant. They just didn't have the ultrasound to prove it. Number 2. Cayenne pepper, the emergency vasodilator. Cayenne capsicum annuum contains capsaicin, a compound that activates TRPV1 receptors throughout the vascular system, triggering immediate vasodilation and increasing blood flow to tissues within minutes of consumption. Herbalists have used cayenne as an emergency circulatory stimulant for centuries. Traditional accounts describe cayenne tincture placed under the tongue during heart emergencies to maintain blood flow until help arrived. Clinical research confirms capsaicin improves endothelial function, reduces blood pressure, decreases LDL oxidation, and enhances peripheral circulation. Studies show it stimulates the release of nitric oxide and calcitonin gene-related peptide, both powerful vasodilators. Traditional use was a small pinch of cayenne in warm water every morning. The burning sensation is the medicine working. Capsaicin is forcing blood vessels open and pushing circulation into tissues that weren't getting adequate flow. Cayenne is too simple, too cheap, and too available for the pharmaceutical industry to care about. But your capillaries care about it enormously. Number 3. Turmeric, the vessel protector. Turmeric doesn't just reduce inflammation, it protects the blood vessels themselves. Curcumin has been shown in clinical studies to improve endothelial function, the ability of blood vessel linings to dilate and constrict properly. Endothelial dysfunction is now understood to be one of the earliest stages of cardiovascular disease, occurring years before any symptoms appear. Studies show curcumin improves endothelial function comparably to exercise and to the drug atorvastatin in certain patient populations. It reduces oxidative stress in vessel walls, decreases inflammatory markers that damage arterial linings, and inhibits the adhesion molecules that allow plaque to begin forming. Ancient Ayurvedic physicians prescribed turmeric for blood purification. They couldn't see endothelial cells, but they observed that people who consumed turmeric daily had fewer circulatory problems, recovered faster, and lived longer. 4,000 years of observation, 12,000 modern studies. Same conclusion. Number 4. Rosemary, the brain circulation herb. Rosemary, Rosmarinus officinalis, was sacred to Greek scholars who wore it while studying because they believed it improved memory. Neurovascular research now explains why. Rosemary contains carnosic acid and 1,8-cineol that increase cerebral blood flow. Studies show even the aroma of rosemary improves cognitive performance, alertness, and processing speed. The compounds cross the blood-brain barrier and enhance microcirculation in cerebral tissues. Improved brain blood flow means better oxygen delivery, faster waste clearance, and enhanced nutrient transport to neurons. Traditional use was rosemary tea for mental clarity and rosemary-infused oil massaged into the scalp for headaches. Greek scholars wearing rosemary weren't being superstitious. They were increasing blood flow to their brains before an exam. It took neurovascular imaging 2,000 years to confirm what a student wearing flowers already knew. Number 5. Hawthorn, the heart's best friend. Hawthorn, Crataegus species, has been used as heart medicine across European and Chinese traditions for over 2,000 years. It was the primary cardiovascular herb in Western herbalism before pharmaceutical cardiology existed. Modern research shows hawthorn berries and leaves contain oligomeric proanthocyanidins and flavonoids that strengthen cardiac muscle contraction, improve coronary blood flow, and reduce peripheral vascular resistance. Clinical trials demonstrate hawthorn extract improves exercise tolerance in heart failure patients, reduces blood pressure, and improves symptoms of early-stage cardiovascular disease. The mechanism is elegant. Hawthorn increases the efficiency of each heartbeat while simultaneously reducing the resistance the heart pumps against. More output, less strain, better flow. Traditional use was hawthorn berry tea or tincture taken daily for heart health. European herbalists called it the heart herb for centuries. Cardiologists overlooked it while prescribing drugs that achieve similar hemodynamic effects, but carry dependency and side effect profiles that hawthorn simply doesn't have. Number 6. Ginkgo biloba, the ancient circulation tree. Ginkgo is one of the oldest living tree species on Earth, surviving for over 250 million years. Chinese medicine has used its leaves for circulation and cognitive function for thousands of years. Modern research validates this extensively. Ginkgo leaf extract improves blood flow by inhibiting platelet activating factor, reducing blood viscosity, and enhancing microcirculation in small vessels and capillaries. Clinical studies show ginkgo improves peripheral circulation in patients with arterial disease, enhances cognitive function in elderly patients, and reduces symptoms of vascular insufficiency, including cold extremities, dizziness, and tinnitus. The flavonoids and terpenoids in ginkgo strengthen capillary walls and reduce their permeability, meaning less fluid leaks out and more blood stays where it belongs. Traditional use was ginkgo leaf tea for mental clarity and circulatory health. A tree that survived 250 million years of planetary upheaval produces leaves that fix human circulation. There's something poetic about that. Number 7. Garlic, the arterial cleaner. Garlic doesn't just fight infection, it actively protects and maintains arterial health. Allicin and other sulfur compounds stimulate hydrogen sulfide production in blood vessel walls, a signaling molecule that causes vasodilation and reduces vascular stiffness. Clinical trials show garlic supplementation reduces blood pressure, decreases arterial calcification, lowers LDL cholesterol, and inhibits platelet aggregation. Studies demonstrate that aged garlic extract actually reverses early-stage plaque buildup in coronary arteries. That's not prevention, that's reversal. Ancient Egyptian workers building the pyramids received daily garlic rations, not for flavor, for endurance. Sustained physical labor requires sustained blood flow. The pyramid builders' supervisors understood that garlic kept their workforce performing. They were right for reasons they couldn't articulate, but that vascular research has now made explicit. Number 8. Prickly ash. The tingle that means it's working. Prickly ash, Xanthoxylum species, has been used in Native American and traditional Chinese medicine specifically for circulatory stagnation. The bark produces a distinctive tingling and numbing sensation on the tongue that's caused by alkylamides, compounds that directly stimulate blood flow and nerve activity. Traditional herbalists prescribed it for cold extremities, varicose veins, poor peripheral circulation, and recovery from injuries where blood flow to damaged tissue needed enhancement. Modern research confirms the alkylamides stimulate microcirculation, increase capillary blood flow, and have anti-inflammatory effects on vessel walls. This herb never entered mainstream awareness because it's specific to traditional herbalism. But in communities where it's known, it's considered one of the most directly effective circulatory stimulants available. The tingle on your tongue is the same vasodilatory response happening throughout your vascular system. Number 9. Saffron. The vessel repairer worth its weight in gold. Here's the one I teased. Saffron, Crocus sativus, was the most expensive medicine in the ancient world, traded ounce for ounce with gold. Used by Persian, Greek, Egyptian, and Indian physicians for conditions involving poor circulation, cold constitution, and what they described as stagnant blood. Vascular researchers have now discovered why it was worth the price. Crocin and quercetin, the primary bioactive compounds in saffron, have been shown to repair endothelial damage, improve blood vessel elasticity, and reduce the oxidative stress that degrades vascular linings over time. Clinical studies show saffron supplementation improves coronary blood flow, reduces blood pressure, and decreases inflammatory markers associated with atherosclerosis. What makes saffron unique is that it doesn't just improve flow through existing healthy vessels, it helps repair damaged ones. Endothelial repair is something the pharmaceutical industry has poured billions into pursuing. Saffron has been doing it for centuries at the cost of a few threads per day. Kings paid fortunes for this medicine. The clinical evidence says they got their money's worth. Number 10. Cinnamon, the capillary opener. Cinnamon, Cinnamomum verum, improves microcirculation at the capillary level where nutrient and oxygen exchange actually happens. Studies show cinnamon dilates blood vessels, reduces blood viscosity, and improves blood flow to peripheral tissues. It also improves insulin sensitivity, which directly impacts vascular health since insulin resistance damages blood vessel linings over time. Traditional Ayurvedic and Chinese use included cinnamon in warming circulatory formulas prescribed during cold seasons and for patients with sluggish circulation. Number 11. Gotu kola, the vein strengthener. Gotu kola, Centella asiatica, has been used in Ayurvedic and Chinese medicine for over 3,000 years, specifically for vascular health. Modern research shows it contains triterpenoids that strengthen vein walls, improve venous return, and reduce capillary permeability. Clinical trials demonstrate Gotu kola improves symptoms of chronic venous insufficiency, reduces leg swelling, and enhances microcirculation. It also stimulates collagen synthesis in blood vessel walls, literally rebuilding vascular structural integrity. Number 12. Horse chestnut, the swelling eraser. Horse chestnut seed extract contains acin, a compound with documented venotonic effects. Clinical studies show it reduces leg swelling, improves venous tone, and decreases capillary permeability comparably to compression stockings in patients with chronic venous insufficiency. European physicians have prescribed it for decades. American doctors rarely mention it. Same compound, same evidence, different medical cultures. Number 13. Beetroot, the nitric oxide powerhouse. And here's the final one. Beetroot, beta vulgaris, contains concentrated dietary nitrates that your body converts directly into nitric oxide, the molecule that tells blood vessels to relax and open. Nitric oxide is the single most important signaling molecule in vascular health. Without adequate nitric oxide, vessels constrict, blood pressure rises, and organs are starved of optimal flow. Clinical trials show beetroot juice significantly reduces blood pressure, improves exercise performance by enhancing oxygen delivery to muscles, and increases blood flow to the brain in older adults. Cardiologists are now calling dietary nitrate supplementation through beetroot a game changer for vascular health. The magnitude of blood pressure reduction in some studies rivals pharmaceutical interventions. Ancient civilizations used beetroot as medicine and as a blood-building food. They observed it gave people energy, endurance, and vitality. They attributed it to the deep red color resembling blood. The real mechanism is nitric oxide synthesis. But the observation was correct. Beetroot does build better blood flow, and it does it through a pathway so fundamental to vascular health that researchers are now questioning why it took this long to study seriously. If you made it here, you now know 13 herbs that ancient healers understood, and that modern vascular science is confirming were right all along. Blood flow is everything. Energy, cognition, healing, longevity. It all depends on circulation reaching where it needs to go. Hit that like button if this changed how you think about what's really driving your health. Drop a comment telling me which herb surprised you most. See you in the next one.